Spinal stenosis in the basic form is a narrowing of the spinal canal where the spinal cord lives. And what that can do is if there's compression on the spinal cord, you can start having symptoms in either the arms or the legs, or a lot of various other symptoms throughout, depending where that stenosis occurs. The main areas of spinal stenosis that we see are in the cervical and lumbar region. And that's because the areas where we have the most movement in our back and the neck and the lumbar spine, and we end up with the most degeneration. There are many, many causes for spinal stenosis, but the number one cause, degenerated discs, degenerated facet joints, causing that canal to close down.
So it really depends where exactly the stenosis is happening. So a patient has central canal stenosis, which is stenosis obviously in the central canal. Usually can, especially if it's in the lumbar spine, it usually causes pain in the back, pain going down both legs. And usually we'll talk more about central canal stenosis, but it's usually something called neurogenic claudication is when a patient, when they walk for prolonged periods, they extend for prolonged periods, they're causing more compression of that central canal, and that really causes those shooting symptoms down the legs, also known as radicular symptoms. Again, also there's different areas where they can have stenosis. You could have it in the central canal. You could have it in the subarticular recess. You can have it in the foramen where the nerve root exits, and then also extraforamen, also even lateral to that lateral border of the pedicle. So if you're having more of the lateral stenosis or lateral disc herniations, you're having pain down one leg more than the other. So it can get really tricky and complicated. So it's really important to know a physician really knows how to diagnose and treat spinal stenosis. Yeah, so the hope is the patient goes into a really good primary care physician because usually patients consult their GP or their primary care physician. And we're hoping again that the primary care physician can lead them to us. Because again, for spinal stenosis, it's really important to do a really good history physical exam. Of course, asking the right questions really helps guide the treatment and the assessment. And then physical exam, we're all physical medicine rehab doctors here. So we have a really good background in non-surgical orthopedics. We're really good at diagnosing and treating spinal stenosis. And again, we'll go into more about diagnosing.